Good afternoon, everybody, and thank you for joining today's update on COVID-19. As of today, we have 238,039 cases, 2,532 new cases reported since yesterday, which is our highest one-day record, 1,140 people in the hospital, and sadly, 3,874 people who have died. We pray for those we've lost and everyone who's mourning a loved one right now. Today, we'll have an update on the key metrics from Dr. Mandy Cohen, our Secretary of the Department of Health and Human Services. Recently, like much of the country and other parts of the world, we've seen higher numbers. It'll be important to continue to watch these numbers over a 14-day period. But one thing is clear. North Carolinians must be even more vigilant in our effort. Complacency will cost lives and hurt our economy. And it's up to everyone to continue wearing masks, social distancing, and using good judgment. Before Dr. Cohen walks through the numbers, I want to share an important update of our efforts to support North Carolinians during this pandemic. We know that COVID-19 has left many people facing serious financial hardships. Too often, families face the impossible choices between paying rent and keeping the lights on, or buying food and other necessities. To alleviate some of the stress, my administration created the $117 million NC HOPE program to support people facing difficulty paying for rent and utilities. HOPE stands for Housing Opportunity and Prevention of Evictions Program. Starting today, renters in need of this assistance can go to 211.org/HOPE to be screened for eligibility and complete the application process. You can also dial 211 Monday through Friday from 7 a.m. to 6 p.m. Payments are made directly to the landlords and the utility companies on behalf of people in need. The North Carolina Office of Recovery and Resilience, NCORE, which is under our Department of Public Safety, stood up this program while continuing their diligent work on hurricane recovery. I'm grateful for all of their hard work and for the efforts of the United Way of North Carolina in making sure the HOPE program can effectively and efficiently support North Carolinians during a difficult time of need. A program we've already started, the Mortgage, Utility, and Rent Relief Program, or MER, for small business owners, continues to accept applications. If you are a small business owner hurt by the pandemic, this program could help, and I encourage small business owners to visit the North Carolina Department of Commerce website to learn more. Finally, I want to remind North Carolinians that today we have two important deadlines. The first is the $335 COVID relief payment for parents. If you claimed a child deduction on your income taxes last year, this payment will come to you automatically. But if you didn't file an income tax return, you must apply to receive this one-time payment. And today is the deadline. You can do this at nc.gov/COVID-19. As we battle this virus, we'll continue working to get resources to those who need it. In addition, today is the national deadline to respond to the 2020 census. This critical tool determines our representation in Congress and how much federal funding will come to our state. To date, a number of North Carolinians have not replied to the census, which could cost our state up to $54 billion in federal funding. If you haven't done it, please complete the census to ensure we make North Carolina count. Only takes a few minutes. Now I'd like to ask Dr. Cohen to give us an update on our key COVID metrics. Dr. Cohen.
Thank you, Governor. And I want to echo your reminder about the census. Today is the last day to be counted. And census data is used to determine how much federal funding goes to our communities. So let's get every dollar we can to support our recovery from COVID. Okay, let's dig into the data. As a reminder, every week we look at a combination of trend metrics. COVID-like syndromic cases, new cases, positive tests as a percentage of total tests, and hospitalization. Together, these four metrics give us a picture of where we are today, and as you are going to see in the data, we are moving in the wrong direction. All right, this first graph looks at people who come to the emergency department with COVID-like symptoms. This is our earliest detection mechanism. To look at that yellow line, you can see that it is going up. This increase is a warning that there is more viral spread happening across our state. Next, we look at new cases. This first graph on cases gives you a look at the trajectory of new cases since the first day we had our cases back in March. The yellow line shows our peak of cases back in July, and then a slight bump in August corresponding to the opening of universities and colleges. And you can see that recently that line has gone up weeks. But let's zoom so you can get a better sense of the current picture, particularly over the months of September and October. And you can see when you look at the yellow line that our cases are trending up. Today, as the governor said, we reported our highest number of cases since the start of this pandemic. Unlike August, our current worsening trends don't link to any one place or any one age group or any one type of activity. This increase is concerning, particularly as we head into flu season. And I should note we will be putting out our first flu report later today, which will show we've already had one death of someone over 65 from flu. Moving on, next we'll look at the percent of tests that are positive. This number has been trending slightly higher, and while we still have days where it's close to 5%, which is better than we were back in July, the trend is going in the wrong direction. All right, our next graph, we look at day-over-day hospitalizations. And you can see from the yellow line that this trend is also increasing. While we have sufficient hospital capacity, some of our smaller hospitals are feeling the strain already. So here's where we are. Surveillance data trended up. It gets a red X. North Carolina's trajectory of cases is up. It also gets a red X. North Carolina's trajectory in percent of tests returning positive is up, but we still have 5%, so this gets a yellow line. And North Carolina's trajectory of hospitalization is up, but as I said, we still have capacity. This gets a yellow line. Now to the capacity indicators, our testing capacity is high. On our peak testing days in the past weeks, labs are reporting upwards of 40,000 tests per day. So this gets an upward arrow. We continue hiring contact tracers to bolster the efforts of our local health department. However, we are hearing numerous reports from our health departments of people refusing to share information and contacts of people that they may have exposed to this virus. Please remember that all information is private and is never shared with a contact. Please answer the call and help protect your loved ones and neighbors. On the positive side, related to contact tracing, more than 150,000 people have downloaded our exposure notification app, Slow COVID NC, but this metric gets a sideways arrow. Our PPE supplies remain stable and we continue to distribute PPE across the state, and this indicator also gets a sideways arrow. So look, this isn't where we want to be, and frankly, it's frustrating. We have the tools to slow the spread and protect one another. The science is clear on masks. They work. They slow the spread if everyone is working together to wear them. I know that no one in North Carolina wants to see us move backwards, so I'm asking all North Carolinians to wear a mask when you are with people that you don't live with. Please find your reason to wear one. Maybe it's to keep your neighborhood small business open. Maybe it's so your children can be in the classroom. Maybe it's to say thank you to a frontline worker. Whatever your reason, I'm asking you to get behind the mask. Thank you.
Thank you, Dr. Cohen. As you can see, our numbers are higher than we want them to be right now. There's not one geographical area or industry to blame. I know we're all tired of this, It's frustrating to feel confined and to do the things we need to do to slow the spread of the virus. But we cannot let weariness and frustration win. Wearing masks and being careful are more important than ever. We brought our numbers down before, and we need to do it again. So even if you're gathering with friends or extended family, or if you're just running into the store for a second, wear a mask, wait 6 feet apart, and wash your hands. We will succeed if we do this together. Also with me today is the Secretary of Public Safety, Eric Hooks, and our Emergency Management Director, Mike Sprayberry. Monica McGee and Karen Magoon are our sign language interpreters, and Jasmine Mativier and Sarah Ariando are our Spanish language interpreters. We'll now take questions from the media, and if you can identify yourself and your organization, we would appreciate it. We'll take the first question.
Our first question is from Michael Hyland with CBS 17.
Hi, this is Mike Hyland from CBS 17. Wanted to ask related to the numbers that came today on the new positives. Given that people have been saying all along we should expect to see higher case numbers as we go into the colder months, should people be prepared to see numbers like we're seeing today consistently in the coming months? And at what point does that trigger any kind of stop on further reopening, including for schools, or even going backwards on our reopening?
So we want to begin to see our numbers go down. And yes, with colder weather and people moving more indoors, there is more chance for viral spread. And this is why we are emphasizing how we need to take these steps to slow the spread of the virus, being more careful, wearing masks. I think we sometimes let our guard down when we are with extended family, people that we know, but in actuality, if we're not living with them, they could be bringing the virus to you and not know it. And so we have to still be careful even when we're around people we know. I heard Dr. Fauci talking about this the other day. Expecting them to be higher, we know that that potential is there and it's certainly happening. But our goal is to get these numbers down. And I think it's important. We will analyze the data as it comes in, and we're not going to take one day. We're going to look at the 14-day period of time to make decisions on what we do about safeguards. But we hope that by working together, we can try to drive these numbers down. We have done this before. When we pulled together more and we were able to drive numbers down, that was a good thing. So we're going to keep working on that. Do you want to add something, Dr. Cohen? Okay. Next question.
Follow-up, Michael Hyland, CBS 17.
Thank you. And Dr. Cohen indicated there doesn't appear to be one specific change with reopening or something that's driving these most recent numbers. What implications does this have for reopening schools going forward, considering that not all schools are in Plan A right now?
Yeah, our number one priority is to get our children safely back into the classroom. We know this is needed. We know this is necessary. But we've given our local school boards the tools to be able to do that, but we are encouraging them to look at the areas, and we are working with them to help them make that determination. Dr. Cohen, would you want to add something to that?
Hi, Michael. As just a reminder, as we think about school reopening in general, it's both the metrics we need to look at as well as the safety protocols. And as the governor mentioned, no matter what plan a school district may choose, and they can choose a Plan A for elementary school or Plan B for middle school and high school to be in person, but no matter what plan they choose, that there are extensive safety protocols that need to come along with that. And that starts with masks for everyone, all students, all teachers, all staff. There's other screening protocols, washing protocols, and others. So it's the combination of those metrics as well as the protocols that are really important to keep both our students and our teachers safe. Thanks.
Next question, please.
Our next question is from Rebecca Martinez with WUNC.
Hello, Governor. It's Rebecca Martinez from WUNC. Thank you for taking my question. I actually have a question for Dr. Cohen. President Trump said earlier today in Greenville that the pandemic is petering out. Do you agree? How would you describe its trajectory in North Carolina?
Hi, Rebecca. Thanks for that. We're reporting our highest day of cases since this pandemic has begun. Doesn't feel like petering out to me, but we can get this under control if we work together, and that's what we're going to do. And I think it starts with us doing those 3 W's. It's wearing a mask, it's waiting 6 feet apart, and washing our hands. Thanks.
Next question, please.
Martinez, WUNC.
Dr. Cohen, I have another thing. You mentioned earlier that some people who are doing contact tracing. How often is this happening? Is it prevalent in specific demographic groups? What reasons are they giving?
Rebecca, thanks for that question. We see about half of folks are not responding to calls that we are making to folks. And that's been about consistent with where we are, but now we're seeing many more cases, obviously, so many more calls going out. And we really want folks to be picking up the phone and talking to our folks at the local health department. We want to understand who may else have been exposed to this virus. We can get in touch with them, and that way we can help them go access a test, make sure they're staying quarantined or isolated. So it's really important to work with your local health department, pick up the phone when they are calling, so we can all work together on this. Thanks.
Next question, please.
Our next question is from Sharon Van Zwieten with Spectrum News.
Hi, this is for Dr. Cohen. Sharon Van Zwieten with Spectrum News 1. Is there any indication that the virus has changed to become more contagious or stronger? And could that be a reason that the numbers are going up?
Thanks for that question. I know that the scientific community has been analyzing this virus as we've gone along. They've seen some small changes in the virus, but nothing in terms of its intensity of being infectious to this point. I think they'll continue to watch this. What we are seeing, as the governor mentioned, as we are seeing a change in weather, we're seeing both lower temperatures and lower humidity. The virus likes that. And so that in and of itself is giving the virus more opportunities to spread in the same settings in which people already were. So we're seeing both people coming indoors more when it's colder, understandably, and we know indoors is where virus can spread more easily. But it is also just the sheer fact that the temperature is lower and the humidity is lower that makes it more conducive for this virus to spread. But we don't think the virus is changing in any way. It is us that needs to make sure that we are being vigilant to prevent the spread of this virus, as we know that we are heading into this change of weather season and into a season where there's other virus circulating like the flu. And I'd remind everyone that you can get your flu shot right now. I hope you have. The governor and I have both gotten our flu shot. It's really important to take every step you can to protect yourself from all of the viruses that may be out there, as well as wearing a face covering to protect yourself from COVID. Thank you.
Next question, please.
Follow-up, Sharon Van Zwieten, Spectrum News.
Thank you, Dr. Cohen. You gave about vaccines. It looks like a number of companies are getting very close to getting what might be a final approval. Has the federal government said anything to the state about any kind of vaccine plan?
Yeah, we are getting ready to turn in our vaccine plan for North Carolina on distribution. We look forward to the day when a safe and effective vaccine comes down. We've got to keep working until that time, and we also know that it'll take a while to distribute the vaccine, and we have to set priorities for the vaccine. But we'll be returning our plan probably by tomorrow, right, Dr. Cohen? And I'll be looking at making sure that we take care of at-risk frontline healthcare workers, at-risk staff and nursing homes, people in nursing homes. We'll be ready to reveal that tomorrow. Thanks. Next question, please.
Our next question is from Dawn Vaughn with the News and Observer.
Hi, good afternoon. Ask more about the vaccine. Is there any more information that you can share today about it? And then we're almost at 14 days into phase 3, and that is set to end in a week. So with the number of red X's and the way things are going, is it fair to say that that will need to be extended?
Well, we're going to look at the science and data, that all of these metrics on a 14-day period before making that decision. That decision is going to be made next week. And Dr. Cohen, if you want to talk a little bit more about the vaccine plan, you can do that.
Hi, Dawn. A couple of things about vaccines. First, there are a number of vaccines that are in trials right now, so they're doing the research. None of them have yet applied for approval through the Food and Drug Administration at the federal government. So continuing to do that work. And what I would say, actually, in the last week, we've seen one of those trials actually need an adverse health effect come from it, which I think is showing us the process is working, right? They are looking to make sure that all of the vaccines that come out of these trials that would go for approval are going to be safe and effective. And so I think the process is working as intended. So multiple vaccines to be developed. I think the other thing is at the beginning, we need to understand that there is only going to be a limited supply of those vaccines, as the governor mentioned. So we're going to have to prioritize certain folks who will be able to get access to that vaccine at first. And then they will be working on ramping up manufacturing that vaccine over a period of time. So I just also want to remember that. So we know we are going to receive limited supplies to start with. And so our vaccine plan outlines how we will both prioritize as well as work on the distribution of those vaccines to make sure that those who are in those top priority phases get access to the vaccine. So a lot more to be done, but like I said, I think a lot of good, important scientific work still to come and data for us still to look at. Thanks.
Thanks. Next question, please.
Follow-up, Dawn Vaughn, News and Observer.
Hi again, thanks. If contact tracing isn't always working because of cooperation, what else can be done to find out what the spread is linked to? And have you considered changing requirements as far as who reports outbreaks then?
Go on, I'll let you do.
Thanks, Dawn. So as you know, we've implemented a new tool in our contact tracing toolkit, if you will. It is an electronic one where you can download an app to your phone for free. You can do it right now. Go to the App Store. It's called Slow COVID NC. As I mentioned, 150,000 North Carolinians have already downloaded that tool. And what it allows you to do is be completely anonymous. You put no personal information. It doesn't track you. And if you would become positive, you put in a PIN number, again, that doesn't identify you into that system, and then it can alert people who you've been near. And again, I think that's just another tool to help us make sure that we can continue to understand if we've exposed others, if we have a positive and we've exposed others. I think the other thing I wanted to mention, and we keep talking about masks, and I just want to take the opportunity to make the point about masks, that they are preventing the virus that you could have from spreading to other people, right? When you wear a mask, you are protecting the world. And that is also what's happening with contact tracing. If someone is calling you related to contacts, by you picking up the phone, you are protecting others that you could infect without knowing it. And I think that's what this, we want to make sure we're being vigilant about, doing all we can to protect our families and our communities as we work together to slow the spread of this virus. Thanks.
Next question, please.
Our next question is from Kate Martin with Carolina Public Press.
Good afternoon, Governor and Dr. Cohen. Thank you so much for taking my question. This is Kate Martin with Carolina Public Press. I'm hoping you guys can elaborate on what might happen if the metrics continue into the future as they have been in the past few days. What measures is the state of North Carolina and the Department of Health planning if this continues the way it's been going? Thank you very much.
I'll let Dr. Cohen comment on this, but we will look at the metrics, determine what might need to be done next. we are trying to control this virus and to control the spread of it. I really believe that if people would take the responsibility to do the things we need to do, then we can take care of the spread of this virus. In addition, the safeguards that we already have out there, if people abide by them, then we also can be successful in slowing the spread of this virus. And part of what we're doing already is talking to retailers, talking to municipal officials, law enforcement, public health officials, to talk about how we can do more to get people to abide by the safeguards that we already have in place that can help us slow the spread of the virus. But I'll let Dr. Cohen talk about that.
Kate, thanks for that question. I want to echo the governor's sentiments, as no one wants to move backwards, but I think you can imagine that if we needed to move backwards, we'd want to start with high activities that were at higher risk of spreading this virus. And so that's what we would concentrate on it. Just like we used a dimmer switch and thought about easing of restrictions, we look at some of those high risk activities. Again, it's a matter of how many high risk activities are we doing all at the same time. But I want to emphasize that we can get these trends under control. We know how to prevent the spread of this virus. We don't have to go backwards. But I also want to encourage our local municipalities and others to look at their own metrics and see what is driving rates of infection in their areas, and work with the community, talk to the community, be leaders in your community about how we can make sure to stop the spread of this virus further.
Next question, please.
Follow-up, Kate Martin, Carolina Public Press.
Hi, thanks for answering that question. I'm wondering, now that we are several months into this pandemic, if you have any better idea about what the high-risk activities are, and if they're, like, God forbid we do slide back into the danger zone or whatever, like, are you going to be shutting down different activities than we did at the beginning of the pandemic? As flu season, as Dr. Cohen said, we are seeing a risk for indoor activities and gathering close together. I'm hoping you can elaborate. Thank you.
Thanks, Kate. I think we do and have learned a lot about this virus and do know the kinds of activities that are higher risk. I would say that the activities that are the highest risk are when you are indoors, gathered together. Imagine what some of those activities are. So it is one of the reasons why indoor bars are still closed here in North Carolina, because you can imagine being indoors, gathered together, taking off your mask to drink alcohol are things where the virus spreads the most. So the things that we would look at first, again, look to the science that tells us how does this virus spread. And again, it spreads most when people are close together, not wearing a mask, and it tends to be more indoors than outdoors. Thank you.
Next question, please.
Our next question is from Rick Curl with the Daily Record.
Yeah, Governor, Dr. Cohen, good afternoon. It's Rick Curl with the Daily Record in Dunn. I have a question. It's kind of a complicated one, and I'm not sure which one of you, or if you even will be able to answer it. The number of deaths in North Carolina, you said was roughly around 3,900. Of those deaths, how many deaths are actually how many had underlying conditions, and what group do those deaths fall in? How many deaths were over the age of 65 in one of the very high risk groups? How many people were in a group that had diabetes, that kind of thing? And for that matter, how many cases are we seeing, on an average like that? Are we seeing more deaths at age 65? Are we seeing more deaths straight from COVID? What are the numbers of that?
Well, thanks for that question. And I'd want to direct you right now to our dashboard. Not only do we have our total number of deaths there, but you will see that is broken out by some of the very questions you're asking. They break out age by race and ethnicity, and it breaks it out into age groups. And as we've been talking about, COVID can make anyone very ill, but it looks like it is more severe for folks who are over 65 or have underlying chronic health conditions. So we are seeing more death in those that are over 65 if they do get this virus. But it doesn't mean it's limited to those who are over 65. And sadly, we lost a couple just the other week, a healthy 19-year-old. So this can be a deadly virus, even to those who have no underlying conditions and who are younger. But it tends to be that the deaths are more in those that are over 65 or have underlying health conditions. But understand that it still takes all of us working together. You can't just say, well, the folks who are at higher risk, we're just going to have them go off and stay at home, and only they need to do something. We all have to work together on this, no matter who we are, what age we are, what our underlying health status is. We all need to be wearing masks. We all need to be socially distant. We all need to be washing our hands, because they are part of our community. And unfortunately, here in North Carolina, nearly half of adults in North Carolina have an underlying health condition that puts them at more risk for COVID. So we have in front of us, but we know what works and we know how to use those tools, and that's what we want to make sure folks are hearing today. Thanks.
Next question, please.
Follow-up, Rick Curl, Daily Record.
Yeah, Dr. Cohen, I had talked to U.S. Congressman Richard Hudson yesterday, and he said the number of deaths in North Carolina, the estimate that he had, the number of deaths in North Carolina at age of 65, the number is 52. Is that number high, low? Is it off the mark a lot?
Thanks for that. I don't have those off, but you can go to our website right now and look at the number of deaths on those 65 and those that are under 65. I think, but I don't. So I don't want to guess. I know that there are more than 50 deaths, unfortunately, of folks who are under the age of 65. But I don't have the exact number. But you can go to our dashboard and you can look at it on any given day. Again, these are all deaths that are reported to us by medical providers who are calling COVID-19 cause of death for folks. So I just want to make that very clear. This is the cause of death is COVID-19 when it gets recorded in our death count for the state of North Carolina.
Having a pre-existing condition or being over 65 shouldn't be a death sentence. Next question, please.
Our next question is from Brian Anderson with the Associated Press.
Hi, Governor Cohen. Brian Anderson here, calling on behalf of the Associated Press. Thank you so much for the question. Was it a mistake, Governor, for you to go forward with the phase 3 reopening, given the trends were not good in the couple days leading up to it? And do you have any plans to dial back or tighten these restrictions when you announce your decision on the current executive order when it expires next week?
On putting in safety look at a 14 to sometimes 21 day window in order to make those decisions, and we make them based on the data that we have at the time. When the next order expires, we're going to be looking at the 14 to 21 day period that we've just experienced. So we're going to let that data be our guide. This dimmer switch approach, I believe, is the best way to control the virus. But as Dr. Cohen has said earlier, and I've said earlier, I think we have a lot of measures in place that if people will abide by them and everybody pulls together, then we can slow the spread of this virus. Dr. Cohen, would you want to add to that? Okay. Next question, please.
Follow-up, Brian Anderson, Associated Press.
And for the previous, shows that there's hundreds of deaths among people below the age of 65 to flag that. But last night at the governor's debate, Lieutenant Governor Dan Forest had referenced 3 states, Georgia, South Carolina, and Tennessee. I know there's valid reasons to complain about Georgia as far as its higher caseload, deaths relative to a similarly sized population to North Carolina. But related to South Carolina and Tennessee, either for the governor or for Secretary Cohen, what lessons can be learned from those 2 states in their reopenings, either for the good or for the bad?
I think you need a measured approach, and we took the advice of health officials looking at the science at the time, looking at the data, and made decisions about a gradual easing of safeguards. I think that where we have ended up thus far, I think that was the correct approach to take. And we're going to continue with that approach, but we also know that safeguards that you put in place, it's whether people pull together, abide by them, and do the thing we need to do collectively to slow the spread. And we need all leaders throughout the state to set good examples and to make sure, and I mean business leaders, church leaders, people who are respected in the community, to send the signal to others, you know, I care about you and I want to do the things that I need to do to protect you. And that means wearing a mask and doing the social distancing and being careful about what you do. And that's what we want. And I believe that North Carolina can lead the way in slowing the spread of the virus if the people of North Carolina can pull together. And I believe that we can. We've done it before, we can do it again. Would you want to add to that? Okay. Next question, please.
Our final question today is from Travis Bain with WRAL.
Yes, thank you for taking my question. Ventilation is something I don't hear a lot of discussion about. I don't see a lot of places that are indoor only with doors propped open or windows, and I don't hear it talked about a lot by officials. My understanding, though, is that can be a good way to avoid indoor transmission. Am I missing something here? Are there ways, if this needs to be more prevalent in our response, it can be more prevalent in our response?
Hi, Travis. Thanks for that question around ventilation. I think it is one component that we need to think about. It's why I was sharing earlier that virus transmission seems to be lower outside than inside. And so if you were going inside, improved ventilation is an improvement. But what I would say is you want to avoid getting virus particles into the air to begin with. And it's why I go back to the masks. We want to layer on safety protocols. I think relying on any one thing as a silver bullet is to our detriment. I think this is about layering on safety protocols. So when you have the opportunity to do something outside versus in, make that choice. The opportunity to be more socially distant versus closer together, make that choice. And when you have the opportunity to wear a face covering when you're with anyone who is outside of whom you live with, make that choice. So I think that's the piece here. I think ventilation can be an important factor, but it should not be the only thing that we think about when making choices. So you want to make sure you're keeping that virus out of the air to begin with, and that starts with the mask. And again, as I was saying, what the mask really does is protect you who might have COVID from getting any of that virus into the air around other people in the first place. That's why if we all do that together, then everyone is not spreading virus out into the air, and thus no one is going to be picking up virus either. So I think we want to focus on the things that layer on precautions. Ventilation is one of them, but I think it doesn't negate the need to focus on masks. Thanks.
Thanks, everybody, for joining us today. Let's all stay safe and let's all work hard together to beat the spread of this virus. Thank you.